Hey, Dr. Brandy here, and I'm really happy today because I am so grateful to be sitting here in front of a fire on a snow day talking to you. Today I wanted to just give you a little information about magnesium. Magnesium, about 80% of people are possibly deficient, at least in America, are possibly deficient in magnesium. And there's over 300 biochemical processes that utilize magnesium in your body. So if you don't have enough magnesium, you can lead to things like inflammation, metabolic syndrome, insulin sensitivity, or even heart disease. One of the things you should know is that calcium and magnesium, they compete in the cell for absorption. So if there's too much calcium, then magnesium can't be absorbed. So we create high calcium creates a magnesium deficiency. So I know a lot of people, practically every patient that comes to me is on some kind of calcium supplement. And then the question becomes, are they taking magnesium, and are they taking it in the proper ratios so that both of them can be absorbed in the way they're meant to? They have like antagonistic effects. So when there's too much calcium and not enough magnesium, it creates an excitatory state in the cell. So this is kind of what happens when we go into a fight or flight response, when we go into overwhelm, overdrive, stressed out. There's an influx of calcium into the cell. And if there's not enough magnesium there to balance that out, we tend to get stuck there. And practically every single patient that I work with is stuck in a fight or flight mode, practically. Some people are on the opposite spectrum of that, but for most of us, I think we're all in overwhelm on some level. So it's vital to get your magnesium and your calcium ratios appropriately aligned. Then you'll be avoiding things like heart disease and hardening of the arteries. So calcium actually hardens tissue. So when we have too much calcium and it gets into the vascular system, you get hardening of the arteries or atherosclerosis. So I know this isn't something that you can feel. There's no symptom of heart disease unless you're having a heart attack and you actually have chest pain. But it's vital, especially as we're getting older, to really pay attention to what's happening in our physiology from a biochemical standpoint. So a couple of things, if you want to bring your magnesium up, you can eat things like almonds and avocados and bananas, spinach, chard, pumpkin seeds. Those are some really good foods to put into your diet if you feel like you're magnesium deficient. The one thing I'm not necessarily a big fan of is just going to the store and buying some magnesium and taking it, because it's the ratio of calcium to magnesium is what's important. It's not just, oh, I need more calcium. If you're eating it in whole food form, it's a little easier for your body to adjust. So if you have a deeper desire to learn about your own physiology and see if your calcium and magnesium ratios are appropriate, and to see if the supplements that you may be taking are actually being utilized in your body, I'm offering a blood draw day and open house on April 2nd. I'm so excited. And all you have to do is register, and you can get a really deep discount on micronutrient testing. So it's literally a lab where they draw your blood. I'll have a phlebotomist there. And when we take your blood, they'll look at it. They'll open up the white blood cells and take a look at it and see how your nutrient levels have been for the past 3 to 6 months. So it's a really awesome test. It's really awesome to know exactly what's going on in your body and to see if your supplements are working. I'm excited for that. So you'll just have to call and register or go to our events page. Maybe I'll put a link to the event right here on the video. So I hope that helps, and I hope your magnesium and calcium ratios are great, and have a beautiful day.